Following a stroke, you may find it difficult to speak, listen, read, and write. These are common signs of a communication disorder called aphasia. Your healthcare team will discuss this with you if you have aphasia. In this video, you'll learn about the 2 common types of aphasia and how they affect your communication, and communication tips to use if you or someone you know has aphasia. Aphasia is a communication disorder caused by damage to the part of the brain that controls language. It's important to know that aphasia does not affect intelligence. There are 2 common types of aphasia, and you may have one or both types. Expressive aphasia means difficulty producing language. If you have expressive aphasia, you may have trouble coming up with the words you want to say or with forming sentences. Switch the sounds within a word, such as saying wish-dasher for dishwasher. Substitute words such as saying chicken instead of fish, or actually use made-up words. Receptive aphasia is the second type of aphasia, and it means difficulty understanding language. If you have receptive aphasia, you may misunderstand what others say, especially when they speak quickly. Find it hard to understand speech when you're in a group of people, misinterpret jokes, or not understand figurative expressions such as "it's raining cats and dogs." If you or someone you know has aphasia, there are things you can do to make communicating easier. If you have aphasia, you may find it helpful to have conversations in a quiet area where there are less distractions. You can also use drawings, gestures, or writing to help communicate. If you are speaking with someone with aphasia, make sure that you get the person's attention before you start to speak. Keep your voice at a normal level and tone. Don't speak too loudly. Speak more slowly than you normally would, and keep your sentences simple, but make sure you don't talk down to the person with aphasia. As I mentioned earlier, aphasia does not affect intelligence. Aphasia can be a frustrating condition that takes patience. Above all, stay positive and give praise when the person with aphasia attempts to speak. Don't focus on errors. Other things you can do to make conversations easier include asking yes or no questions rather than open-ended questions, and allowing the person with aphasia time to speak. Resist the urge to finish their sentences or offer words. Communication is a vital part of living and thriving. If you have any questions about aphasia, please ask your speech-language pathologist or another member of your Lake Ridge Healthcare team.